Turn a group practice into an IOP or PHP in Nebraska. And the real risk isn't the rooms, it's crossing a licensing line you never saw. Ordinary private practice, a licensed treatment center, and Medicaid adult SUD services are 3 different paths. Get the threshold wrong, and the service model, facility path, and claims workflow stop matching your plan. Get it right, and you scope the conversion before you market it. We will walk the decision points, the licensing boundary, staffing gaps, your location, and Nebraska payer readiness. So what does converting a group practice actually involve? It is not just adding group rooms or longer appointment blocks. The structure underneath has to change. The core Nebraska question is whether your model is still ordinary outpatient practice or has crossed into a treatment center that needs facility-level review. Each path can affect your site, policies, inspections, provider enrollment, authorization, documentation, and claims. Here is the cost of guessing on that threshold. Do not assume a therapy group can become an IOP just because it has clinicians and rooms, or that every clinical service is automatically a licensed center. A practice that bills ordinary outpatient therapy cannot assume it can bill adult SUD IOP or PHP without separate enrollment, authorization, and claims review. Before you market the program, resolve 4 questions. Miss one, and the plan breaks after launch. Let us walk through all 4. Question 1. The licensing boundary. Decide whether the proposed model is still ordinary professional practice or whether it has crossed into a treatment center model. Start with Nebraska DHHS Mental Health Substance Use Treatment Centers, Title 175 NAC 18, and the Healthcare Facility Licensure Act. Treat search terms as discovery questions. They may not match the state's exact categories. Validate the path directly before you change the service model. Question 2. Staffing and clinical leadership. IOP and PHP need admissions criteria, level of care placement, treatment planning, utilization review, discharge planning, and clinical oversight. Who owns the program clinically? Who monitors medical necessity? Who handles authorization and denial response? Do not pull a generic staffing matrix from another state. Build it from the proposed Nebraska model and the population you serve. Question 3. The location decision. The current office may be familiar and connected to referrals. That does not automatically make it right for structured outpatient treatment. Group programming, privacy, accessibility, patient flow, family participation, record handling, inspections, and local approvals may matter more now. Decide whether the existing address can support the model, or whether another location is needed before credentialing depends on the site. Question 4. Medicaid and commercial payer readiness. Verify provider enrollment, program credentialing, medical necessity criteria, authorization review, and level of care billing before you rely on the revenue model. If Medicaid is part of the model, start with provider enrollment and the adult SUD service definition source, which distinguishes licensure from billing. Also monitor Nebraska Medicaid bulletins that affect provider operations. Provider Bulletin 26-01 is part of the current source set. Your software should be evaluated at the same time as licensing and staffing because a converted program runs on it. Behave Health's EHR, CRM, and RCM are designed to support admissions, group encounters, and treatment plan updates. They are designed to support authorizations and credential tracking, the documentation a structured program depends on, and designed to support Medicaid and commercial claims and reporting, so the program is ready once the structure is. The hard part is not deciding clients may need more structured care. The hard part is converting the practice without discovering the mismatch too late. Behave Consulting helps operators pressure test the model, agency review, and payer readiness. It covers documentation workflows, admissions design, and implementation planning before launch. Behave Health's EHR, CRM, and RCM then support the program once the structure is ready. Stop guessing on the licensing line that decides your whole conversion. Scope it before you market the service or commit capital. Pressure test your Nebraska IOP or PHP model and see the software that supports it. Book a demo at behavehealth.com.